If you're over 50, or you love someone who is, chances are you've been sent for the same tests year after year. But medicine has changed. Some common screenings may no longer help you, while others you've never heard of could literally save your life. Today, we'll walk through 11 tests to rethink after 50, grounded in science, not routine. The doctor in the story spent 20 years studying guidelines and realized there's no one-size-fits-all panel. Age, chronic disease, family history, lifestyle, and previous results all shape which tests to start, repeat, or stop. Instead of passively getting a yearly checklist, you should ask, what are the benefits and risks of this test for me personally? Standard advice is to screen for colorectal cancer from ages 45 to 75, with colonoscopy every 10 years when results are normal. If you've had 2 clean exams 10 years apart and no family history, some guidelines allow stretching the interval or stopping after 75. Colonoscopy carries risks: perforation, bleeding, sedation complications. So in very old adults, benefit may no longer outweigh harm. On the other hand, if you're over 50 and never screened, talk to your doctor soon. Colon cancer is often preventable when polyps are removed early. For years, women were told to get annual mammograms starting at 40. Newer evidence supports biennial screening from 40 to 74, with a good mortality benefit and fewer false positives, unnecessary biopsies, and overtreatment. After 75, benefits are uncertain, especially in frail patients. Women with strong family history or very dense breasts may need earlier and more frequent imaging, plus ultrasound or MRI. PSA testing used to be almost automatic after age 50. Now studies show broad PSA screening leads to overdiagnosis and overtreatment of slow-growing cancers, causing incontinence and erectile dysfunction. Men 55 to 69 should make an informed, shared decision. Routine screening is generally not advised after 70. High-risk men, family history, certain ethnic groups, urinary symptoms, should still talk carefully with their doctor about PSA. Osteoporosis is silent until a hip fracture, which can cause death or permanent loss of independence. Guidelines recommend DXA bone density testing for women 65 plus and younger high-risk women. Expert groups also advise testing men 70 plus or 50 to 69 with risk factors. Results guide calcium vitamin D intake, weight-bearing exercise, and medications that strengthen bone. Abdominal aortic aneurysm is uncommon but deadly if it ruptures, with fatality rates up to 90%. A one-time abdominal ultrasound for men 65 to 75 who have ever smoked is recommended and reduces HPAA-related deaths. Women who smoke or have a family history may also be considered. The test is quick, painless, and often overlooked. So ask your doctor if you're in this age and risk group. After 50, the risk of type 2 diabetes and heart disease rises sharply. The USPSTF recommends screening adults 35 to 70 with overweight or obesity for prediabetes/diabetes using A1C or fasting glucose, plus offering lifestyle interventions. For lipids, beyond total cholesterol and LDL, it's useful to check triglycerides, HDL, and consider a coronary artery, calcium, CAC, CT scan in intermediate-risk patients to refine statin decisions. Glaucoma and age-related macular degeneration can silently steal vision, so dilated eye exams are advised regularly after 50, especially for high-risk people. For skin, early, thin melanomas are almost always curable, while advanced disease can be fatal. Dermatology groups promote frequent self-checks and yearly full-body exams for high-risk adults. Hearing loss is more than an annoyance. It's linked to faster cognitive decline and a higher risk of dementia, and may be the largest modifiable dementia risk factor at the population level. Regular hearing checks after 50 and timely use of hearing aids can transform communication and may help protect brain health. For adults 50-80 with at least a 20-pack-year smoking history who currently smoke or quit within 15 years, annual low-dose CT scans reduce lung cancer deaths by roughly 15 to 20%. Because screening also brings false positives, anxiety, and follow-up procedures. It's reserved for high-risk people and stopped once they no longer meet criteria or can't tolerate curative treatment. Bottom line, after 50, you don't just need more tests, you need the right tests. Some traditional screens can be spaced out or stopped. Others, rarely mentioned, may be crucial. Write these 11 exams down, bring them to your next appointment, and ask, which of these fit me and why or why not? The best medicine is personalized medicine, grounded in evidence and tailored to your own story. If this video clarified your health checks after 50, please like, share it with your parents or friends, and subscribe to Daily Wellness Routines for more evidence-based, easy-to-follow wellness content. Repeat medical disclaimer.